Hi guys, going to talk about microdosing. We've talked about it before, but I'm going to make it relevant to a recent case because hopefully it's going to highlight again why we do what we do and why we don't run with the herd and why we stand out. Because sometimes when you stand out, you come against resistance. You come against resistance from the old school. This should be done as per manufacturer. This should be done as per... I've always practiced this way. Yeah, there's a problem with the way you practice. So microdosing is the future. So essentially, microdosing is using the minimum effective dose in the most effective way, which should sound quite normal, obvious. Yeah. So I picked up my blood test results yesterday. Not my blood test results, but one of my guys' blood test results. And I was delighted to see that we'd hit the nail on the head in go one. So perfect estrogen, perfect testosterone, perfect free testosterone. And interestingly enough, his SHBG had already risen. So let's talk about this guy. He presented to the clinic. He'd been self-medicating unsuccessfully, and his last estrogen had come back at 700. He was on a reasonably aggressive protocol, but nothing to predict having a estrogen of 700 and a high free testosterone based on his sort of calculated dose. Just as a quick aside, as I do go off on tangents, the harm minimization guys at Body Power were all talking about blasting and cruising, and they were talking about effective doses for cruising. What should you do? Well, actually, no. There isn't an effective dose that you can reel out. So, one of the audience asked, is 250 milligrams a week an effective dose? Now, if you know anything about testosterone replacement therapy, you'll know that that is the wrong way to tackle things, and we should be looking at numbers rather than quantities, and making sure that they stay within the normal physiological parameters for health. So, slight aside, but yeah, so he unfortunately, he'd been struggling self-medicating despite having a lot of experience in the use of anabolic steroids in the past, because unfortunately, there's still a lot of misinformation out there. The reason why he struggled is because he wasn't using the right dose, wasn't using the right way. Funnily enough, his SHBG was in single figures, which essentially meant that his body was metabolizing the ester really quickly. And despite measuring levels in a trough, because his injection frequency was so long, he was obviously increasing his dose all the time because his free testosterone was coming back low because he was measuring it in a trough. That trough was way too long a trough. So, he'd already metabolized the testosterone. So he was having a massive peak and a trough. So we opted for daily injections of testosterone cypionate. I think it was 17.5 milligrams of THC every day and 100 IU of HCG daily. Because of his propensity to aromatization, we did opt for a microdose of examestane, which was 6.25 milligrams every 4 days. And his numbers have come back perfecto. So he's super happy. And I'm hoping the professor of oncology will be super happy too, because they obviously had a conversation about should this chap continue testosterone replacement therapy. The evidence now suggests that the risk for prostate cancer is highest with low testosterone to a relative high estrogen. Now that is becoming a major problem in society because, as we know, we are prone to aromatization because of our exposure to plastics, etc., etc., etc. So it is an issue. So please, guys, get your levels checked. And if you have a propensity to aromatization, look at reversing that. Now, what can you do? Now, the obvious things are pack up the booze, optimize your liver function, eating a clean, healthy diet, lots of water, and losing body weight, fat, because obviously adipose tissue is prone to aromatization. Sorry if you heard the dog sneezing. So yeah, we opted for microdosing examestane and daily injections because of his single figure SHBG. And I'm delighted to announce at week 4, because obviously at 4 weeks when you've got a single figure SHBG, if you measure in a trough, it can't really be a trough, obviously, it's daily injections. But you need to have very frequent injections. And his numbers have come back perfect. All ratios are cracking, and guess what's happened? His SHBG has risen to 17, which demonstrates that now he is optimized. So we always talk about optimization as in, we want a free testosterone between about 0.5 and 1. We want an estrogen between 90 and 120. We want, and we talk about those quantitative numbers, and everybody knows those quantitative numbers, but people misunderstand the importance and relevance of sex hormone binding globulin. Now, I have spoken about this before, so I won't go too much detail. But effectively, in layman's terms, SHBG tries to help you. So the more optimized you are, the more your SHBG will find a natural level, because the purpose of SHBG is to help mediate the transfer of testosterone into the testicles. That's not right. SHV into the cells and help express it. Now, why is that? Well, it's because the half-life of testosterone is really short and really variable. So it's actually helping mediate the primary purpose of testosterone, which is to help facilitate growth and repair. So, microdosing. This chap needed daily injections to help restore his male androgen levels to within normal physiological parameters. And it's not just that. We have demonstrated that microdosing not only gets good male androgen levels, but from a long-term physical and psychological health, the purpose of TRT, again, to try and help maintain homeostasis, his SHBG has risen, which will help facilitate that process. So, we must be over this idea that more is better, because if you're not over that idea of more is better, then you really do need to do your research. I can get you high numbers. Yeah, all right, whatever. So, we should be trying to help our genetics, our physiology, and work with nature, not against it, thinking, I want to be Superman. Well, you're not Superman. The only way that you're going to be Superman or super you is to get numbers that are appropriate for your genetics and your physiology. End of. So you find with the over-aggressive protocols that the high SHBG guys have a massive drop in SHBG, and if you're a low SHBG guy, you will not see a subsequent rise in your levels with your optimized protocol, because you are not optimized. SHBG doesn't always rise even with an optimized protocol, but it's a wonderful marker of optimization. So microdosing, why do we do it? because it's the most effective way of achieving stable levels. You only have to have a basic understanding of pharmacokinetics, and then you have to apply that to the pharmacodynamics to realise that is the future. Watch this space, guys.